Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the full mouth, starting with the upper right 5. We've got an extraction socket present right here. This extraction socket, as you can very clearly see, has very thin buccal cortical plate. The ridge width is approximately in this region is 6.5 millimeters with a height of 10 millimeters. Now, if this area is grafted, then an implant placement is definitely possible, keeping in mind that the parietal plate is still thicker than the buccal plate. This is the upper right 4. The endodontic treatment has been done. Decent endodontic treatment, no periapical radiolucency. This is the upper right 6. Again, we've got endodontic treatment, no crown restoration can be seen here. That's the MB1, and then we've got the parietal, which has a slight bit of a radiolucency, and then we've got the distrobuccal. Now, with the pattern of how this tooth is, we definitely can assume this shows signs of some form of vertical cracks. And then moving to the axial view, you will be able to see that. Thank you very much. Zoom in. There you go. Now we will be able to see if there is any crack in this tooth. Definitely we see signs of a radiolucency, a pedial widening in the distal aspect of this tooth. Here you can see that very clearly. So we can definitely assume that there might be some form of a vertical root fracture with how the tooth is. We've got a huge amalgam or a metallic restoration as core buildup. Definitely signs of cracks can be observed. This is where the furcation area is, very thin furcation area right here, and there is also a radiolucency in the furcation area, which is indicative that this tooth might have a vertical fracture. If it is extracted, we've got 10 millimeters of ridge width with approximately 7 millimeters of height. Moving to the upper right 7, the upper right 7 also has an endodontic treatment. We can very clearly see that the upper right 7 has PDL widening here as well, and especially on the parietal aspect. If this tooth is extracted, we've got 11 millimeters of ridge width with approximately 7 millimeters of height. Apart from that, we see that there is generalized bone loss in this patient. If you have any further questions, please feel free to reach to our team. Thank you very much. There is also a cavity at the lower right 8.